Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Good afternoon and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders presented by CNS Healthcare. I am your host, Nancy Gandolo, Chief Marketing and Outreach Officer. Before we start, we just want everyone to know your mental health matters and it is okay to not be okay. Remember to fill out our 2-question survey for a chance to win a $25 gift card. We value your feedback. Today's guest is Kevin Fischer, Executive Director of NAMI Michigan, who will be talking about mental health advocacy and NAMI's role in the mental health community. Kevin, please tell us a little bit about yourself and then let's dive right in.
Sounds good. Well, first of all, thank you for having me today. I'm always excited to spend some time with my friends at CNS Healthcare. As you mentioned, I am the Executive Director for NAMI Michigan. NAMI is the National Alliance on Mental Illness. We're the nation's largest grassroots mental health organization that's purely dedicated to improving the quality of life for anyone affected by mental illness. So not just people who live with a direct mental illness diagnosis, but for family members, caregivers, and really the community at large. When you think of the fact that 1 in 5 Americans are diagnosed with a mental illness on a given year, 1 in 6 youth, when you put those numbers together, we're talking about almost 80 million Americans. So when you say you are not alone, that's not a cliche. You really are not alone. And so that's our charter. I came to NAMI about 11 years ago. My oldest son, Dominique, was diagnosed with serious mental illness in 2007. He was diagnosed with bipolar and schizophrenia. And unfortunately, after about a 2.5-year battle with mental illness, we lost Dominique to suicide in 2010. One of the things that I learned during that process or that journey was how little my family and I know about mental illness, the diagnoses, the resources and treatment that's available to us in our community, how important it is to be an advocate for your loved ones or for yourself. All of that's really important. And frankly, we were really ignorant to it. And I say that respectfully, but most Americans are. If we're not in the behavioral health system, most of us really don't know what some of these diagnoses mean. You hear people throw around terms like depression, PTSD, bipolar disorder, schizophrenia. A lot of people hear these terms and don't really know what it means, don't really understand what that person's experiencing, don't really understand how we can support them as family members and caregivers. And then equally as important, we don't understand how we can take care of ourselves as family members and caregivers, because I can tell you from personal experience, being a caregiver to an adult with serious mental illness can be very exhausting, both physically and mentally. And that's one of the things we learn. So I came to NAMI in 2011 after losing Dominique, really searching for answers, never thinking it would lead me to the position I'm in now as the Executive Director for NAMI or for being an advocate. I was really just trying to help. So what I learned is I was able to help myself through helping others. So that's how I arrived here. I joined as a volunteer. One thing led to another. And in April of 2014, I accepted the role and responsibility as being the state executive director. And honestly, that was supposed to be on an interim or temporary basis, but 8 years later, I'm still here. And it's primarily because I love what I do and I love being able to help people. And because of my family's experience, I understand the importance.
Kevin, how does NAMI refer people for mental health help?
NAMI is kind of imagine a hub of information. We refer members of the community to resources. Again, many people are unaware. They don't know the CNS healthcares of the world exist. They don't know about community mental health. So when people contact NAMI Michigan, normally it is not on their best day. and they're lost and just trying to understand how to navigate the system. So either at my national office, state office, or even our local affiliates here in Michigan, we connect people directly to resources. So someone lives, when they describe to me that themselves or loved one is experiencing or was just recently diagnosed, then I try to best assess where they are and then directly connect them to resources. I may give them CNS Healthcare's direct number because I think that's the appropriate resource for them at that time. Sometimes the community mental health, it varies by situation.
And then can you talk about some of the programs that NAMI offers for family members of loved ones who have mental health issues or for people with mental health issues themselves?
Yes, we offer a number of what we call NAMI signature programs. One of my favorite is called NAMI Family to Family. It's an 8-week program where we help family members understand, again, what does this diagnosis really mean? What does schizophrenia or bipolar disorder or schizoaffective disorder, what does that really mean? What is that loved one experiencing? Because it's hard to walk in their shoes or imagine what they're going through. Then it is helping understand treatment plans, resources that are available, providers that are available in their community. And again, the last part, which is the one I find that was just so comforting for me, was understanding how to be a better caregiver. Because again, it can be very frustrating when you don't understand why your loved one is not functioning the way they previously had. And sometimes it's very basic, not taking their medication, not getting up and brushing their teeth in the morning or making their bed and those kinds of things. Those are things we take for granted until you're living with someone that you're the caretaker for. So that's one of my favorites. There are school-based programs, Ending the Silence, which are anti-stigma programs. There are peer-to-peer or NAMI connections where we've learned the power of peer supports. Many people respond better to treatment when they're talking to someone who's walked in their shoes and have that lived experience. So there's a wide range. There's a NAMI program called NAMI Smarts for Advocacy, where we train people how to better tell their story and how to become better advocates, whether they are talking to a behavioral health care professional, or maybe they're talking to a legislator where we're lobbying for greater resources. So there's a wide range of education and support programs. And again, they are provided at no cost to members of the community to participate.
Wonderful. If you're just joining us, this is Bright Spot, your community connection to wellness, presented by CNS Healthcare. We are speaking with Kevin Fischer, President and CEO of NAMI Michigan, who is talking to us today about mental health advocacy. Kevin, how can viewers support their local NAMI affiliate? And can you explain what a NAMI affiliate is?
So a NAMI affiliate, some people might refer to it as a chapter. Nationally, there's a national office in Arlington, Virginia. Each state has an administrative office, for example, that I operate out of Lansing, Michigan. And then we establish NAMI affiliates typically by county across the state. There are over 650 NAMI affiliates across the country. Currently in the state of Michigan, there are only 12. We have 4 more that I believe we're going to launch this year. But I mentioned typically it's by individual county. There are some NAMI affiliates due to population density and maybe some other issues where we may have one affiliate that provides NAMI programs to multiple counties. For example, here in the metropolitan Detroit area, there's a NAMI affiliate we refer to as NAMI Metro Detroit, because they provide NAMI programming to Wayne, Oakland, and Macomb County. But then we have affiliates that operate in a single county. For example, NAMI Washtenaw only operates in Washtenaw County. And so the best way to find out if your county has a NAMI affiliate is simply by visiting NAMIMI.org. That's NAMIMI.org. And if you select the affiliates tab, it will tell you where affiliates currently exist in the state of Michigan. And we welcome people to One, if you're in need of education and support services, to join us for that. But also, if you're interested in volunteering or participating in some of our events like the NAMI conference or NAMI Walks event, you'll be able to find all of that information as well.
And what about those who don't have a NAMI affiliate in their area? How would they go about creating a NAMI affiliate?
So my goal is to make sure every county in the state of Michigan has NAMI programming that wants it. What it requires is honestly an individual who is willing to take on the responsibility for leading the effort to bring an affiliate into that county. A great partner, a great way to start is with your local community mental health office, because they typically know many other families that have the same need. We only require 5 members to establish an affiliate. So you only need 5 people in your community who say, we want to be a part of this and we're going to be a part of the inaugural group. NAMI Michigan will help you through the process. There is a paperwork process, and depending on timing in the year, it may take 6 to 9 months to get an affiliate started, because there's a series of things that have to happen in conjunction with NAMI board meeting calendars, both at the state and the national level. But it's not expensive. As a matter of fact, there's little to no cost to establishing a NAMI affiliate, and you would literally just reach out to our office in Lansing and say, my community is interested in establishing a NAMI affiliate. Can you help us walk through the process? And it's fairly simple.
Not so known for their advocacy at the national, state, and local level. Could you talk a little bit about advocacy going on for mental health, throughout the country and throughout our state, specifically of Michigan?
So advocacy is a fancy way of saying that you're willing to fight for something you believe in. Sometimes that term is a little off-putting to people because they think you have to, be really educated, and it's just really just saying this matter is important to me, either because it directly affects me or someone else, and I want to make sure we have the resources available. So NAMI advocates at the local, state, and federal level. We work very closely with our federal legislators like Senator Stabenow and Senator Peters, and really all of our federal legislators to advocate or to fight for resources, making sure we have financial resources, making sure we have human resources. We know there's an incredible shortage of behavioral health care professionals in the country. So we work really hard to advocate for those resources. At the state level, we do the same thing. A lot of that falls on my responsibility in Lansing, which is why my office is located in Lansing. I spend a lot of time with the legislature and the state administration and the Department of Health and Human Services advocating for resources. And it even happens at the local and county level. We are a grassroots organization. We are primarily run by volunteers. And what we know is our lived experience uniquely qualifies us to understand what's really important to individuals living with mental health diagnoses, family members, and caregivers. And that allows us to have a pretty strong voice in Lansing and in Washington when we have needs that need to be addressed.
Coming out of the pandemic, there seems a lot of resources that are being put against mental health, which is great news for all of those of us who have been advocating for that for years. Obviously, we're getting more certified community behavioral health clinics so that anyone can have access to mental health care in the state of Michigan. But other trends that you're seeing that might come out with that money?
Short answer is yes. I think we're making progress. For me, it's never enough fast enough. As I mentioned before, funding is one of many issues or challenges that we face. And I absolutely applaud Senator Stabenow here in Michigan, Senator Roy Blunt out of Missouri, who established the Certified Community Behavioral Health Care Clinics, which frankly is a game changer when it comes to having access to high quality behavioral health care treatment. I know CNS is a CCBHC or Certified Behavioral Health Clinic. and we could not ask for better partners. Another one of the issues or challenges we face, though, is something I mentioned earlier. We have a tremendous shortage of behavioral health care professionals. So we've gone from not having enough funding, and I don't know that we ever have enough funding, but as I mentioned before, funding is an issue, but now you need to have the resources to match it. And that's in terms of behavioral health care professionals, the clinics, psychiatric beds, crisis centers, training for law enforcement. There's so much more that we can do. I am happy to say that, unfortunately, because of the pandemic, we've seen a lot of resources allocated. And so again, yes, we are making progress. There's just so much more to it than funding.
Final two questions. If people want to get involved, how do they do that? And then the second question would be, what's the one piece of advice you would give to anyone who has a loved one that needs mental health help, or they themselves feel they need mental health help?
So how do you get involved? Contact your local NAMI affiliate. Again, you can find that information, their contact information, either by calling my office at 517-485-4049, or by going to our website at NAMI.org. So that's NAMI Michigan abbreviated.org. Connect with your local affiliate. Again, depending on your level of need, if you're a family or individual recently diagnosed and you say, hey, I'm just trying to understand this, that's a great way to start. And because that's how I started. And then it becomes, this is pretty cool. This is pretty impressive and needed, and I want to become a part of it. So you can become a volunteer. Does not require a lot of your time, and it doesn't require any money to get involved. You can come and support events like the annual state conference or the NAMI Walks event this fall. Any of those are really easy ways to get involved. And we're really looking for people who have talent, maybe people who have technical ability or writing skills. You don't have to be a behavioral health professional to become a meaningful member of a NAMI affiliate. And then we provide training. If you decide you want to become a program facilitator and say, hey, this family to family class I went to, I'm so impressed with it, I want to give back. And I want to learn how to become a facilitator so I can do that. We do that as well. The one piece of advice that I would offer to anyone who can hear our voice is this. We know that stigma is the leading barrier that prevents people from taking the very first step to seeking the help that they need, either for themselves or family member or loved one. We talked early on about the fact that 1 in 5 adults and 1 in 6 children are affected by mental illness. That's almost 80 million Americans. You are not alone, and this is nothing you should be ashamed of, because mental illness is a medical diagnosis. It's not a personal weakness or weakness of character. So please don't let stigma stop you from getting the help that you need so you can live your best quality of life. The last piece is, after stigma, after you decide that I want help, then the other issue is being aware of and having access to those resources. And we can help educate the public about that as well.
Thank you so much, Kevin, for joining us today and for all the wonderful information. To the rest of you, thank you for joining us on Bright Spot, CNS and Healthcare's new virtual show. We hope you will mark your calendars and continue to join us Mondays at noon to discuss feelings, struggles, and finding one's way. If you have a topic you want to hear discussed or a guest you'd like us to interview, please drop it in the chat or comment on this video. As a reminder, we will select one winner for a $25 Amazon gift card and announce it next week on Bright Spot. So please take the time to fill out our 2-question survey that is linked in the chat now. Before I sign off today, I just want to remind everyone to be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Have a great week.